what are the conditions that are missed, meaning someone comes to the doctor for one problem and for whatever reason there is a slow diagnosis of asthma? How does that happen?
Well, asthma is a reversible airway obstruction. So in a condition that's a reversible airway obstruction, the patient may not have symptoms all the time. So sometimes they may feel well, sometimes they might have symptoms. It just really varies with each person. So it's not an easy diagnosis to make. And so you really have to use all the tools. You have to get the good history, find out from the patient what's happening with them. Number two, you have to do the right tests like a lung function, which is critical to determine what the condition of their airways and their breathing is. Maybe use an exhale nitric oxide, and then use some medication and see how they respond to it. So it's sometimes not such an easy diagnosis to make. There are other conditions that can kind of mimic asthma. You could get airway obstruction from an aspiration. I had a patient once who was eating a salad, and there were nuts in the salad, and they choked on the salad, and the next thing I know, they come to me about a month or two later, and they're having symptoms of coughing and wheezing, and they were diagnosed with asthma. Well, they were given medication, but they weren't getting better, and they were wheezing. And then that's when the chest x-ray came in, because we did the chest x-ray and realized that there was a problem in the lung. It wasn't just asthma. And then at that point, we realized that they must have aspirated something there. And so we had to get a pulmonologist at that point who was able to go down into their lung with a bronchoscope and take the peanut out. So people can have a diagnosis that mimics asthma but may not be asthma. You got to be careful.
Is asthma connected with other illnesses, or can asthma lead to other illnesses?
So asthma is clearly associated with allergies. So there's a very, very strong association of like sinus, hay fever with asthma. But if somebody has chronic asthma, in terms of leading to other problems, it mainly can lead to other kinds of lung issues, and sometimes where their lung function, if they're not under good control, their lung function could almost continue to be obstructed. And we call it a fixed obstruction. It's not very common when the patient's treated properly, but if they're not treated properly, and let's say there's continued smoking or something like that, it could lead to a chronic lung disease or chronic obstructive pulmonary disease. So really, we've seen that mainly in people who are continuing to be exposed to smoke in spite of the fact that we may tell them not to smoke.
And Dr. Fineman, there's this medical term, status asthmaticus. Would you please tell us about that?
So status asthmaticus is a definition of somebody who has asthma who's in so much difficulty. In other words, their air tubes are so closed down that they're having a lot of trouble breathing. And those are the patients that used to be hospitalized because they needed oxygen. We had to give them extra oxygen. Fortunately, we haven't seen that much problem with status asthmaticus recently because we've got good medications to help control them, like the inhaled steroids. But status asthmaticus is a very severe, potentially life-threatening condition where the tubes can close down and patients need oxygen. So asthma is not without, asthma is certainly a very serious condition. It could lead to as status asthmaticus or even potentially a lethal or a morbid or type of condition if it's not treated properly. But if it is treated properly, it's really can be managed and people can lead normal lifestyles. So I think the goal of patients is to make sure they go to a physician, a specialist who can manage their asthma, make sure they control their lifestyle and control their medication, have a good treatment plan. We call it an asthma management plan, a good asthma treatment plan, so that they can lead a normal lifestyle. And I think that's the main goal.